Welcome back to Zakima's Ridge Homestead. Today's video, once again, will be one of our classes from our local preparedness group. Today's video we are talking about the medical preparations you should have in a bad time situation. As always, I'll put links below for the Amazon store for some of the items that we used and also for the Jace Medical Antibiotic Kit. Hope you enjoy the video. Hello and welcome to our channel. We're glad you're here. Welcome everyone. Today we're going to cover some medical supplies. This class will be similar format to the bug out bag class we recently had. We'll do some talking first, then I'll go through these totes of equipment that we brought for suggestions of things that you might want to have. When we started preparing for this class, we realized that everything we had was in a cabinet in the basement. And we're remodeling the basement, so it was behind stuff in a cabinet in the basement. So if we would have needed any of this medical equipment in an emergency, it would have been hard to access. So when you're preparing your stuff and getting it ready, you want to have it in a location that you can access in 15 to 30 seconds because time matters. You have a severe cut, you got to get on it right away. So try and build your, we'll call it your home clinic that you can access in 15 to 30 seconds. Some items you want multiple locations. We have, which we'll show later, we have a central location where all this stuff is stored, but important things like an eye wash station and some small medical items like some gauze and some Band-Aids should be downstairs at the washing machine. I should have an eye wash station out in the garage. Any place that you could get something in your eye that could cause serious problems, you want to have that stuff close, because if I splash oil or battery acid in my eye, I don't want to have to stumble my way to the house to get an eye wash station. I want it right there on the bench. Same thing if Paula's in the basement and somehow drops bleach and it splashes in her eyes at the washing machine. There should be an eye wash station right there. So you want your bulk of your items centralized, but you want important items spread out where you could use them in an emergency. Whatever you have, you want to try and train with it. We'll show later, I've got a Suture Training Kit, and I forgot to bring it with me. We just bought basically a fake arm for bleeding. It's got an IV bag that you put a blood pressure cuff on for pressure, and it will squirt blood. Something we'll use later, probably in an FTX training. So if you have the equipment, you want to try training on it so that you know how to use it. Just because you don't know how to use it doesn't mean you shouldn't buy it. Because if we do get into a serious situation, there's doctors out there, there's nurses out there, there's medical professionals out there that can treat you, but they're not going to have the stuff to do it because all their stuff's in their office or at the hospital or just not available anymore. So even if you have equipment you don't know how to use, there's somebody out there that does know how to use it, and it can save your life just because your neighbor happens to know how to use it. So don't shy away from getting stuff just because you don't know. A couple things we should be looking at, which we're going to try to arrange a couple classes later. We should all do CPR, and we should all do the Red Cross first aid at some point. Just the more knowledge we have, the better off we're going to be. Okay, now we'll start going through what we have. When we started loading this stuff up, it was somewhat organized. But then we noticed a few things that we didn't have, and we picked a few more things up. So the organization is not quite as good as it was originally.
You want me to turn some lights off so you can see PowerPoint?
It shouldn't even be up yet.
Okay.
That's for later. Some of the things that you're going to want to have is some of the basic stuff that you have now. Medications, you want to stock up on stuff like milk and magnesia. There's a calcium supplement, vitamin C. We have EpiPens, especially since we have bees. We're not allergic, but somebody there might be. So we keep EpiPens on hand. And acids, more constipation stuff, headache relief, ibuprofen, antidiarrheal, acetaminophen. Again, these are just suggestions of things that you want to stock up on. As prices keep rising and the supply chain gets more difficult, the harder the stuff may end up being getting later. Some cold and flu medicine, sore throat spray, some generic Pepto-Bismol stomach relief, dry eye relief, antibiotic ointment, some tooth pain relief, good old-fashioned BC headache powder. Anybody that watches NASCAR knows about BC headache powder. Some ladies antifungal. Something that needs to be a concern in lack of medical care would be those that are still of childbearing age. This would be the like the morning after pill. Should also have condoms on hand, because in that kind of situation, an accidental pregnancy could really cause some issues. Nighttime cold relief, some Mucinex, some more daytime cold relief, feminine hygiene products, both for feminine hygiene itself and for medical. Tampons can be used as a gunshot wound, stuff it in there for stopping bleeding, and the sanitary pads make excellent wound dressings because the main reason they don't stick. They're very absorbent and they won't stick to the wound. So those are very handy to have in your medical as well as what they're actually used for. A thermometer, some caffeine pills. This is antibiotics. They're not regular antibiotics, all of them. Some of these we got from a company called alldaychemist.com. They're actual antibiotics, but they come from India. So some people shy away from them a little bit because they're generic generics, but we have used them in the past and they do work. Just got this, actually came today. It's from Jace Medical. It's 5 different antibiotics. There's a website you go to, answer a few questions. These are actually doctor prescribed antibiotics, so they're more legal than the Indian ones. They come with a guidebook on when to use them and how to use them for different infections, which ones work the best and so forth. If we're not in a grid down situation, you can actually have doctor support through them. You can call them up and ask doctor questions, and they come with all your medical stuff just like you would, and they are technically prescribed. So they're not cheap, but you're paying for the convenience of being able to get an antibiotic without having to go to the doctor and need it right now. A couple generic first aid kits. Normally I would say shy away from the generic kits to a degree. A lot of the stuff that's in there is kind of junky, but it's better than nothing. Throw one of these in the car, something like that. But they're not great. You can get better kits. This one's more of like a trauma type kit. This one is kind of designed for a backpacking trip. So it's got a lot more stuff in it. Some of it's probably good, some of it's probably questionable. So you're better off to buy stuff in the individual packages than you are in kits. That was kind of just the medicine-y stuff. Now we're going to move more into the first aid type stuff. Here's some 3-inch rolled gauze, something you can't have enough of. Here's a box of the 4x4 sterile pads. There's some 2x2 pads. We should have 1 or 2 totes of nothing but gauze and gauze pads, because you can go through them quickly in a bad situation. This bag is full of just kind of some generic-y stuff. There's some rolled gauze in here, a couple packs of medicine and some burn cream. This is more or less stuff we've scavenged out of some of the cheaper kits. That it's good enough to not throw away, but it's not some primary stuff. Some of the sports wrap ace bandages. This is like a Z-fold type dressing for packing in a wound. Regular bandages, some other kind of bandages, some large bandages. These are bordered gauze pads, good old triangular bandages. Another small rolled gauze. Gauze sponge, a larger ace bandage, a couple smaller ace bandages, a bag of Epsom salts, cotton swabs, bottle of alcohol, hydrogen peroxide, some iodine, antiseptic, poison ivy soap, and a couple different sizes of medical tapes, and some alcohol swab pads. And again, what we've got here is not all we have. This is just representative. Like I mentioned with the gauze, you don't want these 3 boxes on your shelf. You want 10 of these and 10 of these. You want as much as you can store, because in the unfortunate event that we end up having to use this stuff, it could be used pretty quickly. And once it's gone, potentially. So let me pack all this back up and we'll move on to the next box. Okay, this box is a little more the heavy-duty type stuff, not normal things, something that you might not necessarily need. Keep in mind that we realize that we are more or less the bug-out location, so we're kind of preparing a little heavier than you would have to do at home, because we know that there's going to be more than just the 2 of us there, and we have to kind of look ahead for that. This is like a leg splint, cervical collar, a blood pressure taker thingy. This one's battery powered. We do also have the regular cuff with stethoscope as well, but that one's theoretically easier to use because you just put it on, push the button, and it reads it for you. You don't have to try and figure it out on your own. It's like an hard eye patch cover. If you need to patch somebody's eye, you can stick it over there and it doesn't push into their eye. We've got a bunch of these. I think you got these like off a marketplace or something. They're catheter insertion kits. Obviously not something we need for catheter insertion, but it contains a pair of gloves, a wipe, and the underpad. So parts of this could be very useful. So we can give some of these out to you guys if you want, because we bought, the box is bigger than this that we have these in. So we've got a ton of these. But it's not, for the use of what it's designed for, we probably wouldn't use it for, but with the underpad and the gloves, it does have good usable stuff in it.
Yeah.
In fact, I brought 2 of those for some reason. Here's a actual eye patch with elastic on it. Some moleskin, not huge medical, but great for blisters. Something you should have in your kit. Some of the liquid bandage. Some burn dressing. This is a dental emergency kit. You can do like I think it's a temporary filling. So we've got a couple of these. The splint stuff. It's a 3-inch compressed bandage. Iodine swab stick. Have some hand sanitizer. This is actually waterless surgical scrub. So we've got a few of these in the small bottle, and I also have like a refill bottle. So we've got some heavy duty hand sanitizer along with regular. A CPR shield, even though I don't believe currently CPR does breaths. I think it's compressions only. It's been a while since I've been certified, but last time I was certified it was changed. You didn't do breaths anymore. This should have been in the gray container, but this is blood stop powder. This is actually for animals. Works well on you just as well, but that's blood stop powder. Some cool and heat pads. It's contact lens solution, but it's basically saline. So you can use this for irrigation. Something else we picked up at probably one of the farm stores, disposable scalpels. Again, this got in the wrong box. It should be in the animal box because it says for veterinary use only on it, but there's some disposable scalpels. This is like a military surgical kit. It's got the forceps and scalpels and so forth in it. The quick clock trauma pack, I think we've got a few of these. Disposable stapler, it's a skin stapler. These come with the stapler, staples, and the staple remover. So if you've got a cut, you can just zip down it with the staples instead of doing sutures.
Who's volunteering at the end of the class? Okay, Chris.
Why are you looking at me?
And speaking of sutures, you've got a box of sutures, and what I mentioned earlier, the Suture Practice Kit. So this has like the fake piece of silicone skin in it with different cuts that you can practice the suturing with. Well, again, something we'll probably do later in FTX. This is a white glue remover. So if you've got the tape and it leaves the residue on, this will remove the tape residue. I actually had this years ago. The way we taped our Doberman's ears. We use this to take the tape off the ears. But it works great for taking like the Band-Aid stickiness off. Some butterfly closures. Compressed bandage. A nasopharyngeal airway. These you should figure out what size you need for yourself. We'll cover that in the next little kit because they're not really universal. They're different lengths, different diameters. I can't tell you how to do that, but I'm getting one of these. So
From your nose to your ear canal.
Nose to your ear.
You measure from your nose to your ear canal, and that's your average size for your nasopharyngeal.
How about diameter? Do you know that?
Diameters are normally pretty standard.
Okay.
You should also get lubricant with those.
Well,
Yeah,
you don't have
this one does not have.
Yeah.
it's in your mouth.
If you
Well,
can
we
get
covered
it,
that one I did.
get the kit with the lube. If you can get
They
the
told
kit.
us to use one per spec for water.
SWAT tourniquet. It's just a big syringe for irrigation. This is a little pair of tweezers with a magnifying glass. Makes it great for pulling splinters out. Got a little generic pair of the folding scissors in here. pair of the good medical scissors, and you want to make sure you get good scissors. This is one of the things that tends to be very junky in the kits. And if you're using these to cut clothing off to get to a wound, the last thing you want to do is take one cut and have it fold over. So you want to find a good, a little more expensive pair of the shears. This is the liquid skin bandage. We have a little pulse ox meter. Just stick on your finger, gives it your pulse and your oxygen concentration. And this is a polymedical surgery type kit. It's got the forceps and scalpel and so forth in it. When you have all that kind of stuff and you're not sure how to use it, good reference is books. And of course you want hard copy books. You don't want to depend on your Kindle, because if the power's out or the internet's down, you can't Google it. So this is Joseph and Amy Alton have a couple of really awesome books out. Survival medicine book and Antibiotics and Infectious Diseases. These are two really, really good resource books. They're not full of a lot of information, but here we have emergency preparedness and first stage merit badge books. At least covers the basics in there. This is a consumer's guide home remedies book. It's got some stuff in there. You want gloves. This is just a huge trauma dressing. Stethoscope. Something you need a lot of is blankets, especially if you're doing the quote-unquote clinic thing like we're planning for. Something we really got tired of wearing, but you need is masks. This is a emergency blanket. It's got the like yellow plastic on one side and kind of like a felt on the other side. And hospital gowns. These are kind of just disposable ones. We'll have another one later to show you. But if you're working on somebody, you want to throw one of these on to keep your clothes clean and to keep anything on your clothes off that patient, and they can put on a patient as well. So that's just a few of those items. I've only got 2 more totes to go through. Before they fall on the floor, we have crutches. Go ahead and cover this real quick. If anyone was here for the bug out bag class, this was mentioned real quick. This is more the trauma first aid kit. This comes out, something's really bad's happened. We've got gloves. I think that's an Israeli bandage. A couple of the triangular bandages. There's 4 tourniquets in here. Small ace bandage. There's some quick clot. There's a couple of the chest seals in here. Some moleskin. Yeah, there's the chest seals. There's the nasopharyngeal airway. This one's actually was sized correctly, and it does have the lubricant attached to it. Chest decompression needle, and it's a good pair of the scissors in here, and there's just some basic first aid, some band-aids and some tape in here, and also water purification tablets. So like I said, you can see what's in this bag. If this thing comes out, things have gotten really bad. And again, what's in this bag should also be in the cabinet. Don't just have 2 chest seals in here and forget about it. We've got a pack of chest seals in the clinic stuff. Well, this, as we were preparing for the class and so forth, these are things that we kind of thought of as an afterthought that should be in here, that didn't get mixed in where they should have over there. Paper towels. I'm going to recommend more of the shop paper towels. These are a lot more heavy duty than your regular home, kitchen towels. They don't shred as bad when they're wet, and I don't think these are as bad with lint as a regular paper towel is. So we're going to keep some of these handy. Sanitizing wipes for your hands. You obviously want to wash well if you're doing anything medical, but in an emergency situation, it's better than nothing. We also have surface disinfecting wipes. Wipe off the bed, wipe off the tools. It's better than nothing. Get you through. Mentioned eye washes earlier. This is just a little eye wash bottle. It's got the cup that you can stick on your eye, and the excess flushes out of there. So we're going to pick up a few more of these, and like I said, I'll have one of these in the garage. Not empty, like it comes. We'll have to fill it with some eye saline. Get one in the basement with the washing machine, and we'll have one in the clinic area. Some regular hand sanitizer. Some bleach. Can be used to clean your tools if you need to, and general sanitization. A soft toothbrush. Not necessary to brush your teeth with, but you could use this to help clean a wound if someone takes a dump into light gravel and they've got gravel and dirt in there. You can use some saline in this brush to gently flush the dirt out. Some disposable razors. You're going to have to, if someone gets cut bad and needs stitched, you really can't stitch over the hair, so you've got to clean up around the area. So just a pack of disposable razors. Good old-fashioned hot water bottle. We can always heat water on a fire and put in the bottle. You can't always plug in a hot water or a heating pad if there's no electric. So go back to basics on that. This is like your underpad for a patient. An IV bottle. We did have cotton swabs before, so there's another thing, cotton swabs. Some burn relief pads. Is this an ice pack?
Yeah.
Yeah, this is a reusable ice pack. This is the, I guess, for lack of better proper terms, a ventilator. It's the cup that goes over the face with the breathing bag.
Bamboo bag.
And this one has, this says it's for training, but it looks identical to the actual medical ones. And this one comes with a child's mask and an adult's mask.
Does it have oxygen tube on it too?
Yes, it's got like a reserve bag. So it looks to be full-blown the stuff, but it was half the price of the real thing. A couple of face shields. This was a
So back brace.
back brace. These are some cotton flour sacks, so just for some cotton cloth. Some more face masks. These are your regular cotton hospital gowns. We found these, a guy in Marketplace was selling these in dozen bags, so we bought 4 dozen. So we've got 4 dozen of the hospital gowns. This is just what, sheets? Because you're going to need, like the blankets before, you're going to need sheets and cloth. Some kind of trays. We picked these up pretty cheap. In fact, most everything in here we got at the same place, pretty cheap. Those are the pre-soaked surgical scrubs that have the little brush on them. A pack of scalpel blades. The ear syringe, ear and nose syringe. Some anti-itch lotion. Gold Bond powder. Some steri strips. a sharps container, because if you end up using the scalpels, you got to put them someplace. So we got a sharps container, and this came as a kit with the throw-up tray and the tray. So you ought to need them both. We're probably going to pick up a few more of these. These would be great if you're doing something and you've got, you know, the 4-inch gauze that are blood soaked. You can just throw them in here to help clean up. So, and that's just, I'm sure this isn't an exhaustive list of everything we should have on hand. This is just what we've come up with over the past couple weeks of basically preparing for this class. So everything we thought might be needed.
You have IV needles at all?
No, not yet. And we do have one more box to go through, and then a little more talking and a couple slides to show on the screen. This last box is where these two items should have been, because as you know, we have animals, and with the horses and the cows and the peacocks and the dogs and the cats and the chickens and whatever happens to be out there at the time, we also need to prepare medically for that. So this tote is all animal stuff. Metamucil. I didn't know this, but apparently horses will eat sand. So when Paula was in Florida, she had the Metamucil to give to the horses to help flush the sand out of them that they would eat. This is just a bag of syringes, and there are some needles in here as well. But we've used these for irrigation. Some baby animals, you can feed them with the smaller syringes. So that's just a big bag of syringes for the animals. Speaking of feeding the other animals, we've got kitten and puppy milk replacer. They are different. Paula does have a recipe for more of a universal type infant animal formula. This is some kind of a sedative that the vet gave us for one of the horses to calm him down when he gets his hoofs trimmed. So we've got a little bit of sedative for that. This is our little med kit for the German Shepherd. It's similar to the one I showed you. Got a lot of the same stuff in it. It has an actual dog-specific tourniquet, and it's got a little emergency leash thing in here. But other than that, it's kind of the same with the triangular bandages and a lot of the same stuff that was in my trauma kit. And we carry this on the dog. This just velcros right to his vest, and it's got a strap that goes over it, so you can pop the strap and pull it off quick. Same as the one I have. This is a quote-unquote emergency halter or harness for the horses. You can loop this around, and if you need to move them quickly. I think there's two different ones in here possibly. Muzzles for the dog, just in case they're injured bad and they're going to be nipping at you. You can muzzle them. Flea collar, bottle for infant animals, just another big irrigation syringe. This was an antibiotic we just had to give to Sam, so we got a little bit of that left over. There's a probiotic, and you'll have to forgive me, I don't know what all these medicines are. You should be up here instead of me for this. This is a topical antibiotic ointment. Looks to be horse-sized bottle. This is probably one of a variety of different wormers we have in here for the horses. This is a thermometer for the horse. If you ever wondered how to take
It unscrews.
take a horse's temperature, If this was a human one, it would be red because of where it goes. And since it goes in a horse, you have to have something to keep it from disappearing in the horse. So this little ring's on there to retrieve it when necessary. That's a thermometer for the horses. This is like a sulfur solution for ringworm?
Ringworm.
Yeah, for ringworm.
Or ring rot.
Some more bloodstock powder. Saline laxative, I assume, for horses. Some vet wrap for their legs, similar to like an ace bandage, but it's like a more soft, cottony, almost like a fleece blanket material. And some more ace bandage type vet wrap. Animals get pretty colors, we get brown. This is some kind of powder for a horse. Do you even know what this
What
is?
it?
Uniprin?
It's like
Oh,
a heavy duty aspirin.
Control of bacterial infections during treatment of acute strangles. Some more vet wrap. So this is a probiotic, similar to this one. That's a powder form. This is a paste form. A couple other wormers. This is a wound spray. Another wound coating spray. Bute is for
Pain.
pain for the horses. This is another couple other warmers. As is this. I think that might be all the warmers. There's so many different worms that an animal can get. You have to have different wormers to cover the different kinds of worms they have. They're not a universal thing. Something else for horses. We're not going to go there anymore.
Is that Toothbrush?
Mineral ice, pain reliever. This is actually like tattoo cover for after you get a tattoo, the clear stuff. We originally bought this for one of the peacocks. It had a bad cut on its back shoulder blades, and we couldn't keep bandages on it. So we bought this to hold the bandages on the peacock. So we just left it in with the medical stuff. It's a nice clear cover to hold stuff down. Any clue?
OB gloves.
Oh, yeah. In case you have to go in the animal. These are the very long plastic gloves. Stethoscope for the animals as well. And another wormer. Hairball remedy for cats. Rain rot relief. This would be what, for hoof? No?
No. Or their back.
Okay.
It's similar to a ringworm.
This is something for pain, probably prescribed to one of the cats. Drinking water solution, antibacterial. Some ear cleaning stuff, mostly used on the cats and dogs. Scarlet oil, liquid wound spray. Some medicated shampoo. The little collar of shame. We've got a couple different sizes of these for the animals, just in case they've got something you don't want them to chew on. Some liniment gel, topical analgesic for the horses. Some betadine solution. It's some of the stuff that, like betadine and the salines, they can be used either way, animal or human if needed. Just a bag of tools. We got some of the different kind of scissors. We got the good scissors, a pair of nail clippers in here, one of the box openers, this tape Explain the tape, the weighing tape.
Oh, it's a weight tape. It's just like a long paper tape, and you can use it to measure around the horse and the length, and you can get an average weight on them, like in case you need to medicate them or worming, so that you can get an average.
Yeah, because everything with the horses is, which it's the same with people. It's dosed by size, by
Yes.
pounds, and with horses it's usually by 100 pounds. Because these antibiotics we were giving Sam, he was getting what, 24 a day
Yeah,
because of his size.
12 twice a day.
He's 1,200 pounds, so it was 12 100-pound tablets twice a day. So you need to know pretty accurately the size of the horse to medicate him. The wormer's the same way. I'm going to show this probiotic, it does the same thing. This little ring, you calculate your weight, you roll up to that weight you need to dispense, and then just dispense it down to where that ring hits. And most tube medications for horses are that way with that ring on.
Because horses are not all the same weight.
Oh,
They are,
Yeah.
But they all have the same power.
yeah,
Banamine
yes.
was for
A colic.
okay, colic, and it's, once again you've got the same rolly thing here with your weight scale. Just roll that up and dispense by weight. Some triple antibiotic ointment. Ours are this big, animals are this big because they're bigger. Vitamin supplement. This nasty looking little device is, what's the technical name on this? A twitch. You actually put the horse's upper lip in here, squeeze down on it, tighten this up, and you can hook this to their halter, and it basically distracts them if you're doing something like behind their head that they might not enjoy. This kind of keeps them preoccupied and lets you work on them. Some flea medication. Just clippers.
Yeah.
Set of clippers, okay, just like the disposable razors for people. We've got the clippers for the animals. And this is just a leftover box of medications we've had. I'm not even going to go through here. That's got a dog and a cat picture on it.
There's a lot of like eye ointments in there.
Yeah, there's eye ointments and probably some antibiotics. These look like eye ointments. That's probably an antibiotic of some kind.
Antibiotics and pain meds.
Pain meds. Cephalin, that's an antibiotic.
That's pain med.
Pain meds. So these look like probably antibiotics. Yeah, more cephalin. So we save all that. Some antifungal cream, and we keep it for the animals because you never know what you're going to need. I mean, this is just a little snippet of all the stuff we have to have because of all the animals. And in a second here, we'll turn the lights off and use the screen and show you what we've got going for storing all this stuff. Because, kind of like I mentioned, this isn't everything. This is just one of things. We probably had to have 3 more totes if we'd have brought everything. And some of it, we would never use. Hopefully we never have to. But if we don't have it, and we need it, and we can't get it, it could cost a life potentially. Either one of ours or one of the animals.
Yeah, we didn't have any of the sanitary napkins in there. The feminine hygiene pads, I always keep those in my vet stuff because they're awesome. They won't stick to a wound, they're absorbent. You put it on there and they wrap it and the bandage will stick to it. They're,
One thing that I didn't see in your diagnostics kit was glucose, a way to measure blood glucose levels. That's going to be especially a common thing with like long-term FTXs and stuff. If someone hasn't been eating properly, they don't know what their blood sugar levels are. That's something that you want to think about getting.
Well, we need to add that to our list.
yeah.
Because we actually have a list of things that we don't have that we should, that we'll be covering here in a minute.
Generic ones are about $30.
Yeah.
Yeah.
This is a few things that were too big to bring. We just picked up one of those. We plan on, every time we have an FTX, we're going to set this tent up in the same location. We're going to stock it with medical supplies. And then if the bug out thing happens, this tent will go in the exact same location that it was at the FTXs. So everybody that's on our property knows that there's the medical tent location. So that it's a common muscle memory thing that you know where the medical location is. This is I think a 16-foot diameter tent. It's got a floor in it. It's got a stove jack in it, so it can be. It's a four-season tent. So we'll be able to put like a little Franklin stove in there, and have our own little clinic. And if things go bad enough, it may not just be our clinic. It might be the neighborhood clinic. We may have neighbors coming up that need some kind of treatment as well. Because if things are bad enough, you're not going to be calling an EMT, you're not going to be going to the hospital. So we're prepared to set up basically our own clinic if needed, which is why we have a lot more than the usual stuff. Speaking of not usual stuff, we just picked up the medical bed that we can put in the clinic. So it's a bed stretcher, this aluminum ring that goes underneath this mattress pops off the bed. It's got a hook at each end, so you can take the pad and this part off, take it out in the field. If somebody's injured, get them on there. We do need to get one more strap for this end to strap the person down, but then you can bring them back in and put the stretcher directly on the bed. It's got a storage tray underneath. We're probably going to have a tote with some items that stay with the bed, and the head end does tilt up on it, and it's got the foot jack, so you can raise and lower the bed, and you can independently tip. Like if you need to elevate the feet, you can tip the whole bed up to do that.
We were looking to get a cot for in, the infirmary, whatever. We're like, what are we gonna? Came across that, said, well, we're getting the surgical gurney. That's it.
Yep.
That's what we're having.
And the same guy that had the gurney. Well, doggone it. Can't get those bars off of there. That is just an IV stand on wheels that goes with the gurney. It also had this little stainless steel tray that there's a little knob right here. The tray part goes up and down, so it's a surgical tray. If things get bad enough, it's all stainless. And this is in the extra bedroom right now. I'm not sure how well you can see. This picture's not great. This is an old locker. It's probably that wide, and it's tall. It's huge. That is where all the stuff in these totes go, plus whatever's already in there that is duplicates of the items that are in there. This one on the side is everything that the animals' medical stuff goes into. So we have an animal medical cabinet and a human medical cabinet. It's off the wall here a little bit. That IV stand goes back in there. The crutches go back in there. And right now we've got that big tent stuffed back in there in that corner. So that's in our extra bedroom. There's our 15 to 30 second access to our medical supplies. It's right there in the center of the house in the cabinet. Eventually we'll have to get this well organized with bins, and we may have to add shelves to it because we just started this. So this isn't a tried and true proven method yet, but we're going to get everything well organized in there so anybody can walk in there and open the doors and find gauze, find pads, find whatever they need. It'll be well marked and well organized for something John mentioned with the blood glucose monitor that we have to add to this list. This is the list of items that we've thought about recently that we need to get, are rather expensive, so it might be a while before we get them because they're kind of a specialty item, or we just have it and haven't found it because this stuff was all over. You know, it's getting this cabinet organized. It's important. So we came across a box of stuff yesterday that we didn't know we had that was in another room. So a few of the items that we do need to still get are some Tyvek suits. Worst case scenario, if there's a deceased person and you have to deal with that, you probably want to wear a Tyvek suit to keep yourself from getting contaminated. We want to get a whiteboard to go with the bed so that if somebody is being treated, you can have important information on that whiteboard about, you know, what their issue is and with how you're treating them. I've thought about maybe getting some kind of a generic medical chart even to have to record like blood pressure and stuff like that if that would be necessary. We've got the crutches. We've thought about getting a walker as well. One of the expensive items would be an AED. They're roughly around $1,000, so that might be a couple year down the road expense if it hasn't already hit the fan by then. But yeah, an AED would be nice to have. Some more serious dental tools beyond just those emergency kits we have. We have just boxes of gloves, but we should probably also have some sterile gloves, just in case you're actually having to get into somebody for something. You're better off with the sterile gloves than just the nitrile gloves. There's a product called Fiber Fix. It's similar to like an ACE bandage, but it hardens, so you can use that for like a cast. We don't have any of that. Something we have in our bug out bags, but we should also have in the medical, will be a headlamp. So if you're treating somebody and you've got that concentrated light on your head where you're looking, you definitely want to pick a headlamp up to put in there. We've got several antibiotic ointments, but there's one that contains silver that's more antibacterial, and I guess it hardens and gives you like a crust over the wound as well. So we want to pick some of that up. Along with the whiteboard, we should have a clock, because if you put a tourniquet on, you need to write down what time you do it. So we're probably going to get like one of those cheap 12-inch wall clocks just to hang in there with the whiteboard, so you don't have to have a watch or pull out your phone to get the time. It's right there. And the last item that we've thought of was, it's called Zip Stitch. It's probably something that anyone with smaller children might be interested in. It's like a sticky bandage that has pulling parts on it.
You pull them close.
Yeah, so when you put it over an open wound, and then you can pull it, and it locks side to side.
Holds it together without having to, I couldn't imagine
So,
having to stitch it.
trying to put a suture in a child over just sticking that on there and sticking it.
Yes, exactly.
I think I have one or two walkers.
Really?
I know I have one, I might have two of them.
Something else to maybe think about is a backboard
Yes, we've thought about that.
with head blocks.
Yeah.
Because even if you have somebody that's on the bed and you have another patient, you can place them on a backboard and then prop them between two chairs, and then you have another workspace.
Yeah.
Yeah, good idea. We'll have to add that as well. We'd looked at those before and never got one.
Because especially if you have somebody with a head or neck or back injury, you don't want to lay them on that soft bed.
No. Well, bright side, you can take the mattress off,
Okay.
and that's aluminum.
Okay.
So it could be an improvised backboard in a pinch.
Yeah.
Some lidocaine powder or patches. If you're suturing somebody, it'd be nice to be able to rub some lidocaine on there before you stitch them. A bedpan we have. That's one of the items that we have that we can't find, but definitely want a bedpan. And the last item was a junctional tourniquet. I learned about these yesterday. If you have a very high wound that you can't tourniquet, it's like a big band that can go around the waist or around the chest, and then it's got an inflatable bag that you would put underneath it and fill that would compress here or here where you couldn't get a regular tourniquet. Be nice to have, but they're like $350. So that's something on the later wish list. Not something everyone's going to have in their personal kit, but something we may end up trying to get for the long-term clinic. And we'll have to add backboard and add the glucose monitor. And last, if this thing would stop.
And they make throwaway head blocks to stick to the backboard.
Okay, just a few tips and tricks. I mentioned before, you're better off to buy items than kits, because if you buy the good quality items, it might cost you a little bit more in the long run, but then you're also not paying for the junk. So you're best to buy individual items rather than pre-made kits, unless it's a very, very good professional grade type kit, which tend to be awfully expensive. Just a little thing for supplementing, something Paula does, save your eggshells. Every time we do eggshells, she'll peel the liner skin out of the inside, the membrane out, let them dry. We get a good quantity of them. She'll put them on a baking sheet and bake them to dry them, and then crush them. And you can use that. You can use it for your plants, for one, when you're doing your garden, but you can use it as a calcium supplement, because women tend to need to take the calcium supplements. So you can use eggshells for the calcium supplement. A suggested location, which is where we got everything that was in that little tray, that pink tray. It's called Ellet Closeouts in Fabric. It's on Canton Road in south of Akron, and it's a fabric store. They've got all kind of fabric in the back, but it's a closeout store. They've got a lot of prepping stuff. I mean, we bought the stuff we showed you. That's where that tent came from. That was like a $700 tent we got for $250.
They've got all kinds of medical.
Yeah, medical
you
stuff.
You name it, they have it.
Yeah.
All kinds of stuff.
Gloves
Yeah,
and
you have got to go.
they had
What's it called?
Ellet Closeouts and Fabric. It's in a little strip mall,
Is it on 91?
Canton Road, which I think is.
That's 91.
Is that 91?
Yeah.
Okay. It's amazing what they had in there. It was.
Yeah.
We didn't get any, but they had like
Just in a strip mall, you'd never know it.
the doctor type gowns that you put on backwards. They had those. We didn't pick any up, but they had those.
The kid that we bought the gurney from
Suggested it.
suggested it, and we went from his place directly there.
And I mentioned previously too, Facebook Marketplace. We got those hospital gowns off of there. We got all those catheter kits off of there. There's always, and that's where we found the gurney, was on Marketplace.
Aren't those catheter kits sterile gloves in there?
Yes.
Okay.
Oh yeah, I wasn't thinking that.
Yeah,
Those are sterile
those are
gloves.
sterile gloves in there.
Yeah.
Yes.
So yeah, Marketplace is a good place. Craigslist. There's lots of people out there that have stuff they're getting rid of, and it's cheap. Like I said, we picked up that gurney for less than we could have bought just a
cot.
a military folding cot. So you get good deals on there. If you have an FSA through work and you have like extra money left at the end of the year, there's a place called FSAstore.com. Everything on there is FSA eligible. So you can just buy it and it comes off your FSA. The way my company was, I had to put it like on a credit card and then I got reimbursed. The place I worked at before, we actually had a Visa, like a debit card for our FSA, and I could have just used that. But that's that big blue hiking first aid kit and those dental kits were something we bought off of there, because if I didn't buy it, I was losing the money. So it's a great resource at the end of the year if you have extra money in your FSA. There's FSAstore.com. Jace Medical is where I got those antibiotics in that green bag. I did post a link on that in Discord. There'll also be one at the end of this video, and I'm probably going to do a separate video just on that. And another place is alldaychemist.com. That's where you can get the stuff from India, the antibiotics and
all kinds of medications.
Yeah, they've got all kinds of medications
It's not
on
just
there.
they have all kinds of stuff on there.
Yeah, there were no like no pain relievers or any like narcotic type stuff on there, but there was got a lot of stuff on there. But there's a lot of antibiotics. They're cheap, and like I said, if you're not worried about them coming from India, it's a good resource as well. No, we've taken them just fine. But that's about all I have on the medical. Is there any questions that we haven't already covered?
For the more tactical components in your IFAC and everything, it was recommended to me to go to Chinook Medical. They have a lot of very inexpensive, actual professional medical grade equipment like chest seals and quick clot and things like that. Israeli bandages that you can get at very reasonable prices from them. That was recommended to me before we had medical training last year.
Okay, Chinook Medical.
That's where I got my needle leak potion.
Yeah,
That's
much
probably where I got a lot of my stuff too.
Dark Angel.
I know
Angel's a good one, but they're expensive.
Yeah, but they were like high quality.
Yeah, I know I don't know what I bought there. It might have been the dog tourniquet, but I get an email from My Medic all the time. So My Medic is obviously someplace I've purchased something from in the past. There's a lot of resources out there, and it's just like the bug out bags. You gotta tailor it to what you think you need, what you're comfortable with, what you can afford.
Exactly, we discussed if you have children.
Yeah.
If you have grandchildren, then your kit is your supplies are going to be different than this.
Yeah.
We discussed we should have a child blood pressure cuff,
Yeah.
which we don't have. Yes, and just things like that
Yeah.
if you have children or young grandchildren, yeah.
And even, it might sound funny, but even something as stupid as having a stuffed animal in there, just to distract a child while you're doing something, it could be something beneficial to have.
Download their favorite TV show on your phone.
Well, not the grid down now, could you?
That's what solar panels are for.
Yeah.
You need to have papoose
And I
for children.
I know how to start IVs. I know how from all my years working in the ambulance. So when shit hits the fan,
Okay, because that's, like I said, we've purchased that fake arm that's got multiple different bleed scenarios in it. It's got vein bleed, it's got artery bleed.
I can't believe
So-
you left that at home.
I know. It's actually sitting on top of the animal cabinet. That's where I stuck it when I got it. But that's something we're going to be using later. We've got that suture kit. We're probably going to pick up a couple more of the suture kits so that multiple people can practice at the same time. And they do have an IV starting kit. It's got the fake arm.
the biggest thing with starting an IV is making sure that you get all the air out of except for the drip tube that's on the line. Get all the air out of there, because if you pump a bunch of air into somebody, then you're dead.
Yeah.
So,
All right, well, I guess we'll conclude the medical class at this point. Thank you.